I am Dr. Aditya Nadella. I am a consultant medical oncologist. So today we'll be discussing about prostate cancer. So first of all, let me tell you what is cancer. Cancer is nothing but an uncontrolled and undetermined proliferation of cells within the body. So what is a prostate gland? So prostate gland anatomically is located at the base of the urinary bladder. So this prostate gland is responsible for secreting the seminal fluid which is required for reproductive purposes. So any cancer developing in this prostate gland is called as prostate cancer. Prostate cancer is very common in India. One in every six Indian males has prostate cancer in India. The early signs and symptoms of prostate cancer are basically difficulty in passing urine. So in normal individuals, you can see that there is a force within the stream of the urine. So when the person is having some obstruction because of cancer of the prostate, the stream of the urine reduces. Or if the patient is having difficulty in passing urine, he feels that he is not able to completely empty his bladder post urination, or there is a frequent and recurrent urinary tract infections. That means there is some problem within the prostate. So this problem in the prostate can be a cancer, or it can be a benign condition called as benign prostate hyperplasia. Or if the patient is having unstimulated or painless bleeding in the urine, so there is blood mixed with urine, that also indicates the patient can have prostate cancer. The most common risk factor for prostate cancer is mainly the age. So as the person ages, the risk for prostate cancer also increases. So usually the prostate cancer risk increases after the fifth or sixth decade, and it reaches its maximum by eighth decade or ninth decade. So age is the most common risk factor. And apart from that, smoking can also cause prostate cancer. And family history is also very important in prostate cancer. And patients with usually a family history of breast cancer or any colon cancer or stomach cancer or pancreatic cancer, these are the individuals who are at high risk to develop prostate cancer. Diagnosis of prostate cancer is done basically by two things. So first thing will be a blood test where we measure an antigen called as a prostate specific antigen. It is an enzyme that is only secreted by the prostate gland. So once there is a cancer within the prostate gland, the levels of the prostate specific antigen rises exponentially. So the normal cutoff value usually we take being normal is around 3 to 4 nanogram per milliliter. So anything above this level, we should give a doubt of prostate cancer, and it can be confirmed by doing a biopsy. So whenever the patient presents with a higher level of PSA and then we do an imaging and we see that the prostate is enlarged, then the person is fit for a biopsy. So during this biopsy, we take multiple tissue pieces from this prostate gland from various locations, and then we study them under microscope, and then any abnormality detected is diagnosed as prostate cancer. Prostate cancer is divided basically into three risk groups. So one is the low risk group, one is the intermediate risk group, and one is the high risk group. So how do we stratify these patients into low, intermediate, and high risk is based on the biopsy results. So once we subject the patient to biopsy and send the tissue for a pathological examination, the pathologist will study the slides and assign the histology into various groups. So this is called as the Gleason groups. So these groups are numbered from 1 to 5. So as the number increases, that means the grade of the disease also is increasing. So a patient, if you take 10 patients with the similar stage and with the similar group, still the outcome of this cancer can be different among various individuals. So many factors, especially the age of the patient, or if the patient is having other diseases, suppose a smoker having lung issues or a person with diabetes and also having a heart issues. So these patients are more likely to succumb to this disease earlier than a patient who doesn't have these other diseases. Treatment of prostate cancer is again multimodality treatment. So there are three types of treatments for this prostate cancer. So it can be as minimal as active surveillance where no treatment is given. This treatment is applicable to mainly elderly people who are 70, 75 plus, who are not fit for any other therapy, or if the patient life expectancy is less than 5 years. So, or if the patient's prostate cancer is a low grade. So, these patients can be just observed every year with this PSA levels and frequent scannings rather than subjecting them to any other treatment. So, the other treatment modality will be either surgical, or it can be a radiotherapy, or it can be chemotherapy. So, depending on the stage of this prostate cancer, the individual is subjected to a combination or any single modality treatments. If the disease is localized only to the prostate, the patient can always undergo prostatectomy, that is, removal of the prostate gland. If the patient does not intend to undergo surgery, he can also be given the option of radiotherapy, where high dose radiation is given to the prostate gland. If the patient does not want even that, so the patient can be given something called as a hormonal therapy, because this prostate gland survives on the testosterone that is secreted by the testis. So once we give the hormonal therapy, we suppress the testosterone and inhibit the growth of the prostatic cancer. So if the patient is in an advanced stage where the cancer has crossed the prostate gland and is extended all to the bones and throughout the body, then the first treatment modality will be removing of the testis. So first, the patient has to either undergo surgical removal of the testis, that is called as orchidectomy. If the patient does not intend to undergo orchidectomy or does not is not willing to remove his testis because of the social taboo, then the patient can be given radiation to the testis, where the radiation kills the normal testicular tissue and the secretion of testosterone is hampered. Or the patient can also undergo hormonal therapy, as I told earlier, where it chemically suppresses the production of testosterone. If the patient post all these procedures still is progressing on his prostate cancer, then the patient can be subjected to chemotherapy or immunotherapy. Prostate cancer can reoccur if it is a intermediate grade or a high risk group. Low risk usually does not recur, but around 5 to 10% of them will recur. Intermediate to high risk groups, around 40 to 50% of the patients will recur. Prostate cancer, as such, will not lead to any infertility, except it might cause erectile dysfunction. Or, but the treatment of prostate cancer can lead to infertility. As I have told you previously, the one of the treatment options for advanced prostate cancer is removing of the testis, or giving radiation to the testis, or giving hormonal therapy to suppress the action of testis. So all these things will ultimately definitely cause infertility. But infertility is not an issue, because this disease usually occurs post sixth or seventh decade. So that time, infertility does not matter.